Hi, my name is Amber Bowman. I'm a graduate nursing student at Gardner-Webb University, and I'm working on my master's in nursing education. Today, I will be sharing with you the healthcare delivery system for Nursing 111, and that is Chapter 11. The learning outcomes for this module will be to assess the effects of competition and regulation on the delivery of healthcare, to outline the levels of healthcare, to recognize the differences in primary, secondary, and tertiary care, and to outline the role of the nurse and the nursing care delivery system. On this first slide here, we are going to discuss the healthcare settings. A healthcare setting is where the care occurs. There are various healthcare settings where individuals can seek healthcare, and they are listed here on this slide. A hospital can be public or private, nonprofit, or for-profit. Public hospitals are operated at a local or state level. An example of a state hospital would be Broughton. Private hospitals can be nonprofit or profit. They can be operated by communities, churches, corporations, or charitable organizations. An example would be the Shriners Children's Hospital. Primary care centers are where your physician offices, clinics, and community centers are located. Ambulatory care centers are a healthcare setting where clients can walk in, undergo a procedure, or receive outpatient medical care, and then go home. An example would be urgent care, minute clinic, or outpatient surgical centers. Home health care is care provided within the patient's home. This may include nursing care or other therapies offered. Extended care would be a long-term care facility such as an LTAC or rehabilitation center. Specialty care settings or centers provide services for specific populations or groups. Some examples would be a mental health center, a school nurse, a correctional nurse, or daycare centers. Care provided for the seriously ill may be hospice or palliative care or even respite care. And then new to the healthcare setting is telehealth. This provides a new way for the delivery of existing healthcare services. One of the key advantages of telehealth is allowing patients to remain in their communities or home while being seen by a healthcare provider at a remote site. This type of healthcare saves money and time. There are various healthcare delivery systems. How the healthcare is delivered is a fee for service. A service is provided and a fee is paid. Physicians and hospitals provide services and a fee is paid either through the patient privately or through their insurance companies. Multi-specialty group practices incorporate physicians from multiple specialties. They unite to share income. Facilities, supplies, expenses, and equipment, along with support staff, are also shared. There are also, these multi-specialty groups are also better equipped to provide comprehensive care. An example of a group may involve a general practitioner, an OBGYN, and a pediatrician. They all provide services to the expenses, clients, facilities, and equipment they all share. Community health centers. These are regionalized services for vulnerable populations with an emphasis on primary care and education. They provide access to care regardless of the ability to pay. An example would be a health clinic. In Mooresville, an example of this type of community health center would be the Ada Jenkins Center. They are a free health clinic. Accountable care organizations are made up of hospitals, primary care settings, and specialty practices. They all come together to provide efficient, high-quality care for populations, and one bill is generated to cover all the care provided amongst that accountable care organization. Medical homes or medical neighborhoods are a new model of primary care that is team-based and patient-centered. The focus is on quality and safety, patient-centered care. There is a partnership amongst practitioners, patients, and their families. They ensure and respect the patient's wants, needs, and preferences. The providers are solely accountable for the patient's physical and mental health needs, including prevention and wellness, acute care when acutely ill, and chronic care. The care is organized along all elements of the broader healthcare system. It includes specialty care, hospitals, home health care, community services, and support services. Access to these services have a shorter waiting time, and there are after-hours numbers or 24/7 electronic or telephone access. Clinicians and staff in the medical home enhance quality improvement to ensure that patients and families make informed decisions about their healthcare needs. There are different levels of healthcare that patients utilize to seek medical treatment. These levels of healthcare include primary care, secondary care, and tertiary care. There's a reference table on page 246, table 11.2, that would be a good resource to look at to help differentiate these services. So primary care, this involves a family doctor, a primary care provider, or a general medical care person who you would seek medical attention from for an acute medical problem. Medical concerns such as a cold, pulled muscle, a rash, flu, or any other acute medical problem would be utilized by seeking primary care, or be treated, by seeking primary care. The primary care provider is responsible for coordinating care amongst other specialists and other levels of healthcare providers. Primary care providers may be a doctor, nurse practitioner, or physician's assistant. There are also primary care specialists who focus on specific population groups, such as pediatrics or geriatrics for general healthcare needs. Secondary care is a level of care that one would be referred to by a primary care provider. These are normally specialists involved in a specific area of the body. If you've been referred to a secondary level of care, you may see someone such as a cardiologist who focuses on how the heart works, or an endocrinologist who focuses on hormone systems and specializes in some diseases. Oncologists, for example, focus on the treatment of cancers, and some may specialize further on specific types of cancers. Some insurances require a primary care provider to refer a patient to a specialist. Tertiary care involves specialized equipment and services, along with procedures such as hemodialysis or coronary artery bypass. A local hospital may not be able to provide these services, so a patient may need to be transferred to a hospital that can provide these specialized services. Access to healthcare depends on the availability of care and the ability for the client to pay for services. Without insurance, patients have to pay out of pocket and cannot afford the cost of expenses. These barriers lead to unmet healthcare needs, delays in receiving appropriate care, inability to get preventative services. They lead to financial burdens and fail to prevent unneeded hospitalizations. Barriers, as discussed, include lack of availability, high cost, lack of insurance coverage, and lack of education. Limited access to healthcare can impact a client in many ways. If they are unable to get appropriate medical treatment, they cannot get better and cannot receive preventative treatment. They will have a poor health status. They are more likely to be diagnosed at a later stage of a disease process, and their life expectancy is shortened because they are more likely to die prematurely because they have not had the preventative treatment or care that would lead to the diagnosis and early treatment of a disease. These barriers impact patients physically, socially, and mentally. Patients are more likely to have increased emotional stress and increased complications from an untreated disease. Higher treatment costs and financial complications also lead to mental health strain. Prevention of disease and disability, or patients are more likely to die prematurely from an untreated disease, leading to disability. Prevention is the key. If one could utilize treatment and prevent disease, it would not lead to premature death or of an untreated disease. Patients are unable to seek medical treatment for a healthcare condition, and this leads to a disease not being detected or treated. Detection and treatment of health conditions is impacted by these barriers. One's quality of life is also impacted. Death that could have otherwise been prevented is not, and one's life expectancy is shortened. Quality improvement strategies that improve access to healthcare are outlined in the National Strategy of Quality Improvement in Healthcare. We want to reduce harm to our patients. An example of an organization that does this is the Joint Commission and their recording of Sentinel events. We want to ensure families and clients are engaged in their care. We want to explain the care and education in a way that clients can understand, and to ensure they understand, we want to evaluate their understanding. We want to promote effective coordination and communication of care. We need to ensure they have appropriate follow-up care appointments when they leave the hospital. We need to identify on admission if they have any difficulties getting to appointments or financial difficulties that may be preventing them from getting the appropriate medical care or medications they need. We want to refer these patients to resource management to see if there's anything we can do to help them and ensure they make their follow-up appointments and take those medications. Promoting the most effective prevention and treatment practices for the leading causes of mortality, starting with cardiovascular disease, is important. This involves starting an education process early, promoting daily exercise, a healthy diet, education on decreasing body mass index, and reducing obesity levels. By decreasing the risk factors of cardiovascular disease, we can decrease the mortality of this disease. We need to work with communities to promote best practices to enable healthy living. As discussed before, exercise, education on healthy diet, and reducing obesity levels is important. We need to make quality care more affordable for individuals and families by developing and spreading new healthcare delivery systems. Competition and regulation. There are several factors that can impact the competition and regulation of healthcare. There's an increased number of older adults. An example of an organization accreditation that some facilities have used is called NICHE. This is Nursing Improved Care for health system elders. A hospital that is certified in NICHE would have an environment that specializes in the elderly population. There's special training and equipment that is specialized for older adults. Some examples would be clocks with larger numbers, thicker mattresses to prevent pressure injury, decreased noise and to decrease confusion, and utilizing more specialized care for the older population. This type of certification in a healthcare system would create competition between hospitals. We also see an increase in consumer knowledge. Clients are able to look up information on healthcare systems. They are well informed, and when they look to come into a healthcare system, they will ask questions. Clients know how to access the satisfaction scores among hospitals, surgical infection rates, and other information. Clients are being more informed and are able to look up more information, so they come in prepared to ask more questions. Another area that patients are more versed in is new and improved drugs and treatment. Patients will come into the hospital and ask specifically about these types of medications and treatments. Location of services is also important. The ability to access a healthcare system locally is important to patients. Some are willing, however, to travel outside of county to get better care. Price and quality of services can also be accessed, again, by the client. They can view satisfaction scores, again, infection rates, and other information about facilities to determine if they want to go there to seek medical care. There are also different innovations and technologies that are developing within healthcare systems. Some facilities have better technologies, and in turn, a patient may choose to go there because they want that better care. There is currently a nursing shortage, and hospitals want to have a diverse field of nursing staff. So facilities know this, and there's competition between providers and facilities to get nurses to come in and work for them. So there's an incentive there for nurses to come into different facilities, whether it's pay, benefits, or the work environment itself. So nurses are also a big part of competition and regulation, and they play an important role. The nursing care delivery system. Nursing care delivery systems can be carried out by a variety of organizational methods. Nursing care models vary from one organization to another. Progressive patient care is an organization of medical and nursing care provided according to the degree of illness and care required in the hospital. Progressive patient care is a systematic grouping of patients according to the degree of illness and dependency on the nurse. Patients are grouped based on acuity. An example would be patients grouped based on illness and dependency on the nurse's care. A facility is split up into units like critical care, an orthopedic unit, etc. These patients are dispersed within those specialized units, and therefore their acuity and dependency on the nurse varies. Unit or department. Different departments would be ICU, ortho, telemetry. They can be split up into several different ways, including total care, primary care, team care, functional care, and case management. Assignment would refer to each unit or department making their nursing assignment either geographical or by acuity. Geographical, for example, would be assigning a nurse rooms 1 through 5. The patients are grouped together, the pros and cons, all in one area, but the acuity may vary. They may all be total care, dependent patients. Acuity, if an assignment is based on this, you may have 2 dependent patients, 2 low acuity patients, and 1 being discharged. It's a combination of different acuities with different needs in mind and the nurse's care needs. I hope you were able to get what you needed from this lecture and that we met the learning outcomes. I look forward to seeing you in class after you've reviewed this information and working on some activities.